Hi there, this is Dr. Megan Rhoads, clinical psychologist. I'm going to explain the treatment plan worksheet that you will use to help us in collaboratively creating a plan to help you tackle the problems that bring you in for therapy. So, first, let's identify two of the most pressing problems you have. So, let's say that problem one on page one is anxiety. And let's go to page two. Problem two, let's say, is relationship issues. So back to page one. So we've identified anxiety as one of the more pressing issues that you're wanting to work on. And so we're going to identify two goals. So, how are you wanting to improve your problem with anxiety? So, goal one, let's say, is for you to reduce your frequency and duration of panic attacks. Let's say goal two is you're wanting to improve your sleep. All right, so we have our goals identified. Next, we're going to identify the objectives, and these should be measurable behaviors, so something that we would be able to see you do that are reasonable for you to accomplish. So, for example, we don't want to aim for something like your panic attacks will occur less often because we may not be likely to control that. But what we can have you do in an effort to reduce the frequency or the duration of your panic attacks is to have you one would be to maybe you're creating an action plan for you to follow during and after a panic attack. Another thing might be that you are going to create and practice a daily mindfulness exercise. Let's get that in there for you to have some anxiety reduction skills. So then the next question would be, well, how do I acquire the skills that I need to create and follow through on my objectives? So that's where I come in with my therapeutic interventions for us to work on together. So we might have anywhere from 1 to 3, maybe even 4 of those interventions. For the sake of our example, let's say we're going to, for you creating your action plan, that usually consists of you learning and practicing a calming phrase for you to learn during panic attacks. Also, during these panic attacks, let's say you want to learn and practice mindfulness, deep breathing, and some grounding exercises. And then for our last intervention, let's say that we want to focus on identifying safe people for you to call in case you're needing help during or after a panic attack, or if you're wanting to decompress. And we would go through the exact same steps for goal two, and the same thing for problem two for the relationship issues. So since we can identify all of these pieces, so the problems, the goals, the objectives, the interventions, we can then begin to implement this plan during our sessions or our communications with one another. And we can track your progress as we go and modify this plan as needed to help you meet your treatment needs. So to get started, I'll have you come up with 1 to 2 problems you want to address. You may already have an idea of those, as well as 1 to 2 goals within each of those problems. So that's up to 4 goals altogether, which is plenty for us to work on at once. And then I'll have you go ahead and send those to me, and I can help you identify what your objectives and the interventions of treatment will be. And then we can get started on having you learn and practice these skills to help you meet your goals.